Good morning. Welcome to Raaonline. Today we are going to talk about shoulder joint. Shoulder joint is a very important joint in the sense, whenever I see this word important in my students' answer scripts, I always have a small smile. Everything is important, is it not, in our body? But then why I wanted to use this was, this is something which identified us humans from the lower animals. See, all the lower animals used all the four limbs mainly for locomotion, for movement. But it is in the apes and still further finer movements which was possible in the human beings, all because of the freeing up of the four limbs for activities other than locomotion. So this freeing up of the lower limbs is mainly because of the shoulder joint, which helps us in the mobility of the upper limbs and thereby allowing us to do lot of skilled, fine, coordinated movements. So that is what identifies us humans from the other animals, the ability to do skillful activities, artistic activities or musical activities. All those things are associated with fingers, and that movement has been more pronounced because of the presence of shoulder joint, which frees up the upper limb, the appendage, from the main trunk in such a way that we are able to move our upper limbs in whichever way we want. That is not an option in lower limb. So the hip joint is more for stability, because we would be seeing some comparison. Both are ball and socket, both are attaching the trunk to the appendages, whereas the hip joint is for stability and ensuring that we move without any trouble. The shoulder joint is more for the activities that we undertake with the upper limb, especially the freedom it gives us to use it in the maximized way as possible. So with that introduction, we will go to the shoulder joint. Under competency based CBME curriculum, it is covered under 10.12, where the shoulder joint has to be described and demonstrated under these subheadings. These subheadings are common for any joint. What is the type, the articular surfaces, the capsule, the synovial membrane, the ligaments, relations, movements, the muscles involved in the movements, the blood and the nerve supply, and the applied anatomy. So this is what is common for any joint, and this is what we are going to see for shoulder joint also. So this is just to reiterate what we are going to see in the subsequent slides. Whichever is covered, supposed to be covered under the curriculum, is what is enlisted here. So shoulder joint is a type of synovial joint, and we know that under synovial joint there are multiple types, of which shoulder joint is a multi-axial synovial joint of a ball and socket variety. So the ball is the humerus, the head of the humerus acts like a ball, and the socket is the glenoid fossa of the scapula. So scapula is the bone, and scapula, the glenoid fossa, acts as a socket for the head of the humerus, which is the ball. So this is the shoulder joint. What are the articular surfaces? So as I just said, the head of the humerus is the distal articular surface. It is directed medially, backwards and upwards, whereas the proximal articular surface is the glenoid fossa or the glenoid cavity, which is in the lateral end of the scapular bone. It is directed laterally and forwards. Now you can see the blue line which is depicted here, which is the articular cartilage. So just like any other synovial joint, the articular surfaces are covered by the articular cartilage, which is hyaline here. That is, again, hyaline cartilage is the cartilage which covers majority of the synovial joints except for a few exceptions. So here it is covered by the hyaline cartilage. to reduce the friction, is it not? And between this is the cavity, the synovial cavity filled with synovial fluid. Now, there is a small difference in the way the articular cartilage is present over the articular surfaces. So, in the head of the humerus, the articular cartilage is very thick in the center, whereas thinner in the periphery. To accommodate this articular cartilage, to ensure that there is a good fit, opposition, snug fit with the articular surface, the articular cartilage which is covering the glenoid fossa is actually thinner in the center and thicker in the periphery. This is to ensure that the congruence of the articular surfaces is better maintained.